I've been working in Uganda for 3 years. And a woman there who's born has a 1 in 16 lifetime risk of dying of a pregnancy-related complication. And it's about 1 in 50,000 in developed countries. My motivation has always been to help improve the health of individual patients, but also of groups of people, and to try to improve the system through which we deliver care. When I was finishing residency, I wanted to continue to do work in global women's health. And the Brigham and the Connors Center were the only place at that time that had the vision to create a program like the Global Women's Health Fellowship. I want the work that I do to decrease maternal mortality. I really think that through the work that I'm doing now and what I'm learning about how to do this kind of work and the connections I'm making, really joining a cadre of people and a team that's going to continue forward with our partnerships and collaborations to create programs that will improve the lives of women and families and children throughout the world.
We first went to Mongolia to study some questions about hormones in milk, but we ended up staying there because of more interesting questions about vitamin D. Our biggest effort to date, although we've pulled off now about 5 studies, the biggest one was the Blue Sky study, where we studied 750 children, 3rd and 4th graders in the capital city Ulaanbaatar over the course of a winter to test various different methods to improve their vitamin D status. And we got really striking results for how we could raise the levels of the vitamin D in the children. And when we went to the Ministry of Food and Agriculture, who of course is the body you want to convince that perhaps a national food fortification program might be a good idea, they took one look at the data. We opened up that laptop on the table and they took one look at the data and their jaws dropped. They'd never seen anything like it. They'd never seen, first of all, just how low the kids' levels had been at the beginning of January and how much they improved with these interventions. So we're just so excited that not only are we getting the word out about vitamin D, about the state of public health in Mongolia and vitamin D, but also things are beginning to happen on a policy level that's going to affect the whole country. So for a researcher, being at the Brigham is like being a kid in a candy shop. So for example, now we want to go back to Mongolia with a much larger project. We'd love to study vitamin D to prevent the pregnancy condition preeclampsia in 5,000 women over 5 years. One of the most exciting things is if I need an expert in vitamin D genetics, he's across the street. If I need the endocrinologist who can tell me about vitamin D dynamics during pregnancy, she's down the hall. I really believe that what we do when we go abroad and we do health interventions or health research has a profound and enduring impact long beyond that visit. And then finally, I think there's just an element of goodwill. You know, when we go over there, they see in our research teams and our clinical teams the best of what America has to offer.
So in terms of getting into global health, I think that I always knew I wanted to work internationally. This is my first trip to Botswana. I planned for my first trip to really be an information gathering trip in the broadest sense. So I spent my time working in the hospital, working with the medical officers, working with the nurses, working with the patients, coming to understand both the culture of the people and the culture of the hospital, the medical culture in Botswana. Laying that groundwork, meeting people, having them know me, having me know them is a very, very important, necessary part of doing research internationally. For me, I love working directly with women, directly with patients, really knowing one community well. But still on that level, I need the skills to develop effective interventions and improve the healthcare of that community. The Division of Women's Health at Brigham and Women's Hospital is fiercely devoted to women's health around the world. They strongly believe that change can come about through education and teaching, and I think that's why they've created a fellowship. Instead of developing programs themselves overseas, they've developed a fellowship to train providers who will subsequently go on to work internationally for many years to come. There is no home and abroad. We're just one big global community. So, you know, we go where we're needed.